Diabetes. 15 silent signs you should be aware of at night. Sleep isn't just about resting, it's a reflection of your overall health. Your body can send subtle signals at night, hinting at deeper issues. Did you know that diabetes often doesn't announce itself with a loud warning? Instead, it's like an underground river, quietly flowing beneath the surface of your body. The symptoms you experience during the night are the first ripples, early signs of trouble before things escalate into a much larger issue. In this video, we'll uncover the 15 subtle signs that show up each night, hinting that diabetes might be the cause. Watch until the end to recognize these signs and gain practical advice that could transform how you manage diabetes. Let's dive in. Number 1. Night sweats. A silent storm sending mysterious signals when you fall asleep. Your body enters a state of relaxation and regulation. However, if you wake up in the middle of the night drenched in sweat, it's not just a random occurrence. This could be a sign that your blood sugar levels are dropping too low. In such cases, your body releases adrenaline to try to raise blood sugar levels. This process increases your heart rate and activates your sweat glands, resulting in excessive sweating. Additionally, this could be related to nerve complications caused by diabetes. The nerves that control your sweat glands can become damaged, causing a malfunction in the system. If night sweats are a frequent issue, start by monitoring potential underlying factors. First, check your blood sugar levels before bed. Research shows that stable blood sugar levels in the evening should range from 90 to 130 mg/dl. Next, consider a light snack before bed with low glycemic index foods. For example, a slice of whole grain bread with a touch of peanut butter. Ensure your sleeping environment is comfortable, with temperatures kept between 64 to 70 F 18 to 21 C to minimize excessive sweating. Finally, if this persists, consult with a healthcare professional. They may suggest an HbA1c test to evaluate your average blood sugar levels over 3 months or assess nerve function to check for potential diabetic complications. Number 2. Leg cramps. A sharp pinch interrupting your sleep. Sudden painful spasms in your legs often occur due to an electrolyte imbalance, particularly a deficiency in important minerals like potassium, magnesium, or calcium, minerals that diabetes can disrupt. Another cause is peripheral neuropathy, a common complication of diabetes. When nerves in your legs become damaged, they may send incorrect signals to the muscles, triggering painful cramps. This not only disrupts your sleep, but can cause significant discomfort. Leg cramps may also result from poor circulation, another common issue for people with diabetes. When arteries don't deliver enough oxygen-rich blood to your legs, the muscles may contract involuntarily, especially during the night when your body is inactive. To reduce the risk of leg cramps, make sure to include essential minerals in your diet. Add potassium-rich foods like bananas, sweet potatoes, or avocados, and boost your magnesium intake with leafy greens, nuts, or whole grains. Before bed, try a few simple calf stretches to improve circulation. One easy exercise involves standing about 12 inches 30 cm away from a wall, placing your hands on it, and leaning forward to stretch your calf muscles. If cramps occur frequently, check your blood sugar levels and consult a doctor to evaluate your nerve or vascular function. Number 3. Restless leg syndrome. RLS. The endless dance of the legs. Restless leg syndrome, RLS, is characterized by an irresistible urge to move your legs, often occurring in the evening or at night. Research shows that RLS is closely linked to peripheral neuropathy, a common complication of diabetes. When nerves in your legs become damaged, they can produce sensations like tingling, prickling, or uncontrollable restlessness. This leads to significant discomfort and disrupts your sleep quality, trapping you in a cycle of fatigue. Additionally, RLS is associated with an imbalance of dopamine in the brain, a chemical that regulates muscle movement. Diabetes, by disrupting metabolic processes, can indirectly affect the production and use of dopamine in the body. If you frequently experience restless sensations in your legs, the first step is to make lifestyle adjustments. Engage in light exercises like walking or stretching your leg muscles before bedtime to relieve nerve tension and improve blood circulation. Increase your intake of iron and magnesium, as deficiencies in these minerals are often linked to RLS. Foods like leafy greens, cashews, and oats are excellent choices to help alleviate this condition. Additionally, avoid stimulants such as caffeine or nicotine in the evening, as they can exacerbate restlessness. Number 4. Sleep apnea. Disruption of life's breath. Sleep apnea isn't just about moments of gasping for air during sleep. It's a condition where airflow to the lungs is temporarily blocked, leading to oxygen deprivation in the body. For individuals with diabetes or those at risk, sleep apnea is more than just an isolated event. It's a factor that can worsen overall health. When the body lacks oxygen, the brain sends emergency signals to wake you up and restart breathing. This leads to repeated interruptions throughout the night, which increases the risk of blood sugar imbalances. Furthermore, sleep apnea is associated with increased insulin resistance, making diabetes harder to manage. This condition also strains the cardiovascular system, raising the risk of high blood pressure and severe complications such as strokes. For people with diabetes, this dangerous combination makes disease management even more complex. So, what should you do? Start by monitoring symptoms of sleep apnea, such as loud snoring, sudden awakenings, or a sensation of choking during the night. Lifestyle changes are also crucial. Lose weight if you are overweight, as excess fat around the neck can compress the airway. Additionally, avoid alcohol or sedatives in the evening, as they can overly relax the airway muscles, increasing the risk of apnea. Number 5. Frequent nighttime urination. Nocturia. The endless journey to the bathroom. Frequent nighttime urination shouldn't be considered just a random occurrence. When blood sugar levels rise, the kidneys work overtime to filter and eliminate excess glucose through urine. This process causes you to urinate more frequently, even during the night. As a result, you not only feel fatigued, but also face the risk of electrolyte imbalances and dehydration. Nocturia can also be linked to other issues, such as kidney dysfunction and often seen complication of diabetes. When the kidneys become damaged, their ability to concentrate urine decreases, leading to more frequent trips to the bathroom. The ultimate consequence is the disruption of your natural sleep cycle, causing prolonged sleep deprivation that affects your overall health and your ability to manage blood sugar levels. To reduce nocturia, start by controlling your water intake in the evening. Be mindful of how much you drink before bed to prevent excessive urination during the night. If nocturia persists, consult your healthcare provider to rule out any underlying issues related to kidney function. Number 6. Excessive thirst. An unquenchable thirst is your body's way of signaling the need for more water to maintain balance. However, when you're constantly thirsty, especially at night, it could be an early sign of high blood sugar levels. As the kidneys work overtime to filter and eliminate excess sugar through urine, this leads to more frequent urination, as we discussed earlier, which causes the body to lose water quickly. This triggers constant thirst. If left unchecked, excessive thirst can lead to electrolyte imbalances and worsen other symptoms. It can also be a sign of chronic dehydration or the onset of type 2 diabetes, as the body tries to maintain a balance between blood sugar and water. If the thirst persists, it can place significant strain on the kidneys and circulatory system. To manage this, make sure you're drinking enough water throughout the day, but avoid drinking too much all at once. A good strategy is to spread your water intake out over the course of the day. If you notice excessive thirst accompanied by dry mouth, frequent urination, or fatigue, consult a doctor. Adjusting your diet, medications, or lifestyle can help you better manage the condition. Number 7. Pain or numbness in the legs. Peripheral neuropathy. Pain or numbness in the legs, especially sensations like tingling, burning, or a loss of feeling, is often not just random. It could signal peripheral neuropathy, common complication for people with diabetes. When blood sugar levels stay high for extended periods, the peripheral nerves, particularly those in the legs and feet, become damaged by the excess sugar, disrupting normal nerve function. These symptoms typically occur at night when your body is resting, but your nerves are sending abnormal signals. Loss of feeling in your legs makes you more vulnerable to injury or infection without realizing it, which could lead to severe complications like foot ulcers. In extreme cases, there's even a risk of amputation. Additionally, pain or numbness in the legs can disrupt your sleep. To manage this, stay more active and engage in light exercises like walking or yoga to improve blood circulation to your limbs. Don't forget to care for your feet daily. Inspect them for early signs of cuts, blisters, or infections, and wear well-fitting, soft shoes to protect your feet from injury. Number 8. Nighttime hypoglycemia. The silent intruder in the night. Nighttime hypoglycemia occurs when your blood sugar levels drop below normal while you're asleep. When this happens, the body activates protective mechanisms, releasing adrenaline and other hormones. This leads to symptoms like sweating, rapid heartbeat, trembling, or even suddenly waking up feeling panicked. If not detected and managed in time, nighttime hypoglycemia can lead to serious complications like seizures, loss of consciousness, or in rare cases, coma. To prevent this, monitor and record your blood sugar levels before going to bed. Ensure that your levels fall within a safe range of 90 to 130 mg or dl. If your blood sugar is lower, consider adding a light snack with protein or complex carbohydrates, such as a slice of whole grain bread with peanut butter. Number 9. Insomnia. Not just tossing and turning. Insomnia isn't just about lying awake in bed. One common cause is blood sugar instability. When blood sugar levels rise too high or drop too low during the night, the body reacts by releasing stress hormones like adrenaline, which can keep you alert and prevent you from falling back asleep. Moreover, insomnia is closely linked to insulin resistance. When sleep is frequently interrupted, the body produces more cortisol, a hormone that raises blood sugar levels and reduces the effectiveness of insulin. This creates a dangerous loop between poor sleep and uncontrolled diabetes. To improve your sleep, start by maintaining a regular sleep schedule. Going to bed and waking up at the same time each day helps your body establish a stable circadian rhythm. Check and manage your blood sugar before bedtime to ensure it's within a safe range. A light snack with complex carbohydrates, such as whole grains or chia seeds, can help keep your blood sugar stable overnight. Also, avoid using electronic devices at least an hour before bed, as the blue light emitted by screens can interfere with sleep. If the problem persists, you may need to undergo sleep function tests or consider therapies like melatonin supplements or lifestyle changes. Number 10. Acid reflux. The smoldering flame in the night. Gastroesophageal reflux disease (GERD) is a condition where stomach acid flows back into the esophagus, causing a burning sensation in the chest. This discomfort often occurs at night. One of the main causes of reflux in people with diabetes is autonomic neuropathy, a common complication of diabetes. This condition reduces the ability of the stomach to contract and empty properly, causing food to stay in the stomach longer and increasing pressure on the lower esophageal sphincter, leading to reflux. When the digestive system is disrupted, the absorption of sugar and diabetes medications can also be affected, increasing the risk of blood sugar fluctuations. To reduce reflux symptoms, start by adjusting your diet. Avoid foods that trigger reflux, such as fatty foods, spicy foods, chocolate, caffeine, and alcohol, especially in the evening. Opt for lighter meals that are high in fiber, and eat at least 2 to 3 hours before going to bed. When sleeping, elevate the head of your bed by about 6 to 8 inches 15 to 20 centimeters, and consider lying on your left side to reduce reflux symptoms due to the natural structure of the stomach and esophagus. Maintaining a healthy weight is also crucial, as excess weight increases pressure on the lower esophageal sphincter. If symptoms persist or worsen, you may need medications like proton pump inhibitors (PPIs) or undergo a gastric function test to rule out other issues. Number 11. Nightmares or vivid dreams. The horror movies of the mind. Nightmares or vivid dreams can be so intense that they suddenly wake you up. When blood sugar levels drop too low or rise too high during the night, the brain becomes overstimulated, putting your body into a state of stress. This can lead to dramatic dreams, such as running away, facing danger, or feeling extreme fear. Additionally, vivid dreams can sometimes signal a sleep disorder related to diabetes, such as sleep apnea, which deprives the brain of oxygen and triggers stress responses throughout the night. To minimize vivid dreams, start by establishing a relaxing bedtime routine. This can include reading, meditating, or practicing mindfulness techniques to calm the mind before sleep. Number 12. High blood pressure in the middle of the night. The silent thief. Typically, blood pressure drops slightly during sleep to allow the body to rest and regenerate. However, if blood pressure remains high or even increases during the night, it signals an imbalance in the body's regulatory mechanisms. In people with diabetes, this condition is often linked to damage in the autonomic nervous system, which controls vital functions like heart rate and blood pressure. Additionally, high blood pressure at night can be triggered by an increase in stress hormones like adrenaline, which are often released when blood sugar drops too low. Hypoglycemia or spikes suddenly during the night. These fluctuations not only put additional pressure on the cardiovascular system, but also disrupt sleep, causing fatigue and deteriorating overall health. High blood pressure at night is also a significant risk factor for complications such as stroke, heart attack, or kidney failure, especially when combined with diabetes. To manage this, first monitor your blood pressure at night. Especially if you suspect issues, use an automatic blood pressure monitor that stores data, which helps you and your doctor track fluctuations accurately. Reduce salt intake and avoid processed foods at dinner, as they can elevate blood pressure. Also, steer clear of caffeine or stimulants before bed, as they can increase both heart rate and blood pressure. Number 13. Palpitations. The unusual drums in the chest. Palpitations, or the sensation of a fast, strong, or irregular heartbeat, often occur at night and can wake you up suddenly. For people with diabetes or those at risk, this phenomenon is not simply due to stress or fatigue. It may be linked to abnormalities in blood sugar levels and the cardiovascular system. Additionally, palpitations can be a sign of an electrolyte imbalance, which is common in people with diabetes. An imbalance of minerals such as potassium, sodium, or magnesium can cause the heart to beat irregularly, leading to the sensation of palpitations. Palpitations at night may also reflect issues related to high blood pressure or cardiovascular disease, which are common complications of diabetes. To minimize and manage palpitations, start by checking your blood sugar levels before bed to ensure they are stable. If blood sugar is low, having a light snack with protein or complex carbohydrates, such as a slice of whole grain bread with peanut butter, can help maintain stability throughout the night. Increase your intake of essential minerals like magnesium and potassium through foods such as bananas, almonds, and leafy greens. These not only support cardiovascular health, but also help improve electrolyte balance. Number 14. Teeth grinding. The squeaking sound in the darkness. Teeth grinding, or bruxism, often occurs at night and can leave you waking up with jaw pain, headaches, or general fatigue. One of the main causes of teeth grinding is blood sugar imbalance. When blood sugar drops too low at night, the body activates a stress response by releasing adrenaline, which leads to muscle tension and the uncontrollable habit of grinding teeth. Number 15. Morning headaches. The painful morning greeting. When blood sugar drops too low, the brain doesn't receive enough energy, leading to morning headaches. This is often accompanied by other symptoms, such as fatigue, sweating, or a feeling of shakiness. Additionally, morning headaches can be linked to sleep apnea, a common sleep disorder in people with diabetes. When the airway becomes interrupted, oxygen supply to the brain is reduced, causing headaches and fatigue upon waking. Furthermore, dehydration or electrolyte imbalances during the night, often caused by frequent urination in diabetes, are also common triggers of early morning headaches. To reduce morning headaches, create an ideal sleeping environment to minimize the risk of sleep apnea. Keep the bedroom cool and quiet, and avoid stimulants like alcohol or sedatives before bed. Drink enough water throughout the day, but limit excessive fluid intake in the evening to reduce the risk of dehydration. If you frequently experience electrolyte imbalances, include foods rich in potassium and magnesium such as bananas or leafy greens to help improve this condition.